Vaccine for younger children could be available within weeks. So here to answer your questions is Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. We can't wait. Great to see you, Dr. Moffatt.
Good to see you too.
I don't know if you can tell through the TV, but Erica and I are excited about that. We've had a lot of developments this week for parents and pediatricians to process. But let's talk about that Pfizer news first. So the company has now submitted its trial data to the FDA for that smaller dose, that 1/3 dose of the vaccine that could be distributed to kids 5 to 11. What will federal regulators and doctors like yourself want to know about the safety?
So what we'll really be looking at, including those evaluating this data for the FDA, will be what were the reported side effects, and were any of them severe side effects? And that usually means like a side effect that warranted some sort of a medical evaluation. I think it will be important to note how long children were followed after they received these vaccines. And taking all of that together, what the reviewers will be looking for is any safety signal that once these vaccines are potentially rolled out to millions of 5 to 11-year-olds, do they pose a risk? So those will be the main things they'll be looking for.
Okay, so unvaccinated kids not only have the risk of COVID-19 this winter, but of course the flu as well. So what ages are eligible for the flu shot? And what's the risk this season if they don't get one? I know Halloween is kind of the point that people are hoping kids are vaccinated by.
Yeah, so anyone over 6 months should be eligible for a flu vaccine. So they should certainly be discussing that with their pediatrician. I think the risks this flu season are that because we had such a mild flu season last year, it's possible that we will have substantially more flu transmission this year. And restrictions are not what they are this year, as quite as strict as they were last year. So that is a possibility. I think it's also just the reason then to really push people to get flu vaccines is because we know that these are safe vaccines and we know that they're effective at keeping people from getting very sick from the flu. So we know those things. We don't yet know what's in store for us this flu season, but based on what we know, I think the vaccines are really a no-brainer.
All right, we also want to ask you, Dr. Moffatt, about the CDC's urgent health advisory that came out this week for women who are pregnant, trying to become pregnant, or just delivered a baby. Why do you think so many of them have declined to get vaccinated for COVID?
I think this is really rooted in just a very natural and strong sense to do everything possible to keep a pregnancy or a newborn as safe as possible. And then that's doubled with this perception that these vaccines pose a risk to pregnancy. But in reality, we know now from multiple reports, multiple data sets, that these vaccines are indeed safe in pregnancy and safe in those just before becoming pregnant as well as safe to people who just completed a pregnancy. And that's offset by the other important piece of data that we've shown many times now, that COVID infection during pregnancy does pose a risk for pregnancy complications.
Well, not only that, but Dr. Moffatt, so, experts saying that the vaccine is safe. How dangerous is COVID for, a pregnant woman and the child? Is there a risk of miscarriages, even stillbirths from COVID?
So what we know about COVID infection in pregnancy is that it is clearly associated with increased risk of severe illness for the pregnant woman. It also is associated with an increased risk of going into preterm labor and having a preterm delivery, as well as an increased risk of other complications for the newborn. The data I've reviewed do not clearly yet suggest COVID-19 infection being associated with an increased risk of miscarriage or of stillbirth. And on the other hand, in terms of COVID vaccination, we now have many data sets as well demonstrating that COVID-19 vaccination during pregnancy or just prior to becoming pregnant is also not associated with an increased risk of miscarriage. So it's really important to get this information out there.
Go get vaccinated for COVID and the flu. Dr. Kristen Moffatt, an infectious disease specialist at Boston Children's Hospital. Good to see you, Dr. Moffatt. Thanks for your time.
Thank you, doctor.